There are major differences between working with a midwife and working with an obstetrician. And it's really important that you understand both philosophies so that you can choose what feels right to you. In order for me to explain the differences between a midwife and a doctor, I think it's important to talk about liability and how a midwife and a doctor might assess risk when they take on a patient or a client. There's a term used here frequently in medicine, and it's called defensive medicine. And it's this idea that sometimes obstetricians, when they provide care to their patients, they often make decisions or suggest certain interventions that protect them legally, but may or may not be in your best interest. Now, when we talk about an OBGYN or an obstetrician, they are going to inherently assess risk differently than a midwife. OBGYNs go to medical school and they become experts in high risk, complicated births. What do I mean by this? High risk means something different depending on who you ask. So it's really important that when you're using your discernment and you are interviewing with a provider, that you ask enough questions to determine, okay, how they're describing risk, does this apply to me? So for example, when it comes to assessing risk, let's take age. Anyone 35 and over, an OBGYN is going to consider high risk, or essentially there's a term called geriatric pregnancy. Not very nice, but they have to factor in age to them as something that makes someone high risk. Whereas a midwife, age is not a risk factor in and of itself. They are assessing risk differently. They're looking at the whole complete person. Did they have any underlying health conditions before they got pregnant? How is the baby developing in utero? They're really factoring a lot of things. So they're not just looking at age alone and making that become a risk factor. So because of the nature in which OBGYNs assess risk, they are not experts in normal, healthy, physiological birth.